Hello class, my name is Emily Parsons, and for this week's discussion post, I will be discussing the topic of healthcare disparities. Healthcare disparities refer to the unfair and avoidable difference of healthcare access and quality of care based on one's race, age, religion, sexual orientation, socioeconomic status, or geographic location. These healthcare disparities will lead to poorer health outcomes for these specific populations. There are many different topics of healthcare disparities, but the topic that I chose to speak about this week will focus on mental health. Mental health care disparities are a major issue that exists within my community. There are many negative stigmas that surround mental health. For example, some people may be perceived as crazy, delusional, attention-seeking, dangerous, or incompetent. For these reasons, many people avoid seeking help for their mental health concerns. According to the American Psychiatric Association, 18% of adults in any given year have a diagnosable mental disorder, and only 43% of people with a mental disorder receive treatment or counseling, no date. The Mirror and Associates argue that Blacks and Hispanics are more likely to endure severe or debilitating episodes of mental illness that go untreated compared to white adults, 2023. That statistic alone proves that there is a disparity in mental health care. The American Psychiatric Association also suggests that some barriers that might prevent minority groups from seeking mental health care include stigmas, lack of insurance, language barriers, lack of diversity among healthcare providers, and just a general distrust of the healthcare system, no date. These disparities will ultimately lead to poorer health outcomes, increased mortality rates, and increased hospital healthcare costs by evidence of frequent emergency room visits or hospitalizations for mental health crises such as suicidal ideation. The emergency room at my place of work is always busy attending to those with a mental health crisis, and I have noticed that children ages 12 and under are being brought in more frequently due to either suicidal or even homicidal ideation. The American Psychiatric Association argues that mental health is the leading cause of disability in the United States, no date. This is a major concern for our community, and it must be addressed in a way that causes an actual change within our healthcare system. Some ways to address mental health care disparities are by lobbying for new laws and policies to improve access to healthcare, reducing stigmas of mental illness by educating the public, and partnering with community organizations that serve diverse populations. Partnering with these organizations can help identify and address specific needs of minorities' mental health. There are several different community programs that focus on minority mental health care. One example being the Anxiety and Depression Association of America, who openly states they provide research for Blacks, Latinos, Asian Americans, LGBTQ+, and low-income populations, no date. As nurses, it is important for us to advocate for all populations' rights to receive mental health care, especially those who have disadvantages or challenges in seeking professional help. Thank you for listening to my discussion on mental health care disparities, and have a wonderful day.